When someone has a standard hearing test after a concussion, it's easy to assume we're simply checking whether they can hear. We are instead doing something more specific. A standard hearing test, which we also call pure tone audiometry, maps the quietest sound each ear can detect pitch by pitch. That map answers a defined set of questions. Has the hearing sensitivity changed? Do the two ears match, or is one clearly worse, which after a head injury may require medical follow-up? Is there anything in the pattern that should be investigated before we go further? Those are the questions this test is built to answer, and they're the right place to begin. What it doesn't measure is how someone manages an actual conversation, coping when several people talk at once, or how much effort listening now takes. That is a separate question, and it needs a separate tool. So in a post-concussion assessment, this is the groundwork. Establish hearing sensitivity, compare the two ears, and decide whether anything needs a closer look before we build on it.